Hey everybody, it's Dr. David, the ENT doctor. I'm just having a reflective moment, just looking at the past few days, weeks of conversations that I've had with parents. And I think there's things that I say to parents on a frequent basis that's probably worth sharing. So one of the things I talk to parents about when they bring their child in is in the context of a child that has a diagnosis of ADHD sitting over them. And let's make it absolutely clear, ADHD is a real thing. It's part of the neurodevelopmental spectrum of things. But what I find quite interesting when we go through and look at the science and research is I came across two articles where a department of psychiatry that was involved in looking after kids' ADHD reflected on the fact that they thought maybe about 25% of the children that they were treating with medication actually had an underlying breathing or sleep disorder. And then they published another paper about 2 years after that, where what they had done is brought the ENTs in to have a look at the kids to see what the reality was. And they were off the mark a bit. It wasn't quite 25%. It was 50%. 50% of children going through their department, getting medication for ADHD, basically needed to see the ENT. And when the ENTs got these kids breathing better and sleeping better, a lot of them didn't have ADHD. And where those that did, a lot of them didn't need anywhere near as much medication to control their ADHD. So the take home for that really is that we shouldn't be ignoring sleep. Sleep is such a crucial part of healthcare. So that's one thing. Another reflective moment. A child that was being assessed for developmental delays, struggling at school, not progressing as well as they possibly thought that they should, and was going through a childhood development assessment. Not a single person had asked this child about sleep. Not one. And this child was brought in by their mother, who had seen me on Facebook, who we went through the story. This child was mouth breathing, waking up tired, was cranky first thing in the morning, irritable. They had restless sleep. They were tossing and turning, sweating at night, still wetting the bed. And the mum wondered if maybe this could be a contributing factor. And I said, well, absolutely it could be. And it's a factor that we need to manage. And when I had a look at this child, lo and behold, their nose was quite blocked, their nasal turbinates were quite large, their adenoids were quite large, their tonsils were perfectly fine, everything else was okay, it was just blocked nasal passages. So we both agreed that getting her breathing better would be a very good step in the right direction. So that's another reflective moment. Another reflective moment is I'm starting to see adults come in who have a history of having had orthodontics and teeth straightened and so forth, who despite the best efforts and intentions of the orthodontist, their teeth then going crooked. And they, obviously through the passage of time, from childhood to adult, end up seeing a different dentist. And that different dentist then picks up the fact that this person can't breathe properly. They may have a tongue tie. There are functional problems. And it's been suggested to me by them that we need to get these things optimised to facilitate things. And as you hopefully all know, I'm all about breathing. So if someone, for whatever reason, can't breathe through their nose, I'm going to make sure that we give them the best chance to do so. So that's another example of the sort of things that I'm seeing on a growing basis. The other thing I'm seeing on a growing basis is allergies. And if I sort of look at what I'm doing now surgically to help children breathe better, I'm doing operations on noses that 15 years ago, yes, I'm that old, 15 years ago, I wasn't even contemplating in certain age groups. So, children under the age of 8 was hardly ever contemplating nasal surgery to be done. But over the passage of time, I'm seeing more and more kids with significantly blocked noses at a younger and younger age. I've started doing operations that I used to do in 8-year-olds in 2-year-olds to get their noses unblocked so they can breathe. So I think that's another thing I just want to emphasise to families about managing allergies, is that it's actually really important. It's really important that anyone who's sort of, what I'm talking about is hay fever type allergies, so nasal allergies, runny nose, sneezing, those sorts of things. It's important that they know that they don't have to put up with it. It's not normal, and yes, you do need to treat it. You need to manage it, because kids with hay fever allergies have lower school marks. Their school grades are lower, and that's irrespective of whether they've got a breathing problem. It's just purely because of the irritation of having an itchy, runny nose and sore eyes and, being all snuffly. It's very distracting. If they're in a situation where they're getting nasal obstruction, not breathing and sleeping properly, well, that's icing on the cake from that point of view. So in terms of managing allergies, it's pretty straightforward. Can they breathe or not? If they can breathe, then you manage that with medical therapy and allergy clinics. And there's a treatment within the allergy clinic called desensitization, which is a treatment to try and get them used to what they're allergic to. The other thing, though, if they can't breathe, they have to breathe. And if you can't do that with medication, they get an operation. The operation won't cure allergies, but it opens up the airway, and that's crucial for their well-being and development. So that's another thing that I'm seeing from that point of view. And I guess the last thing that I don't understand, because we have, here in Australia, we have guidelines put out by our Australian ENT Society that says that children that have upper airway obstruction that need surgery need to be put onto, if it's going through the public hospital system, need to be put on a waitlist system where they are prioritised, where ideally, and there's a difference between ideally and reality, but ideally are fixed within 3 to 6 months. And a lot of these children are being put onto wait lists where it's ideally 12 months. And the reality is that it ends up being somewhere around about 2 to 3 years down the track that these children are getting fixed. That's a lot of time at school where these children are not breathing properly, not sleeping properly, and not learning properly. And I think it's a huge disservice to children because it's not their fault. It's not the family's fault. It's nobody's fault. We have a situation where a child cannot breathe properly, where we have national guidelines that are being ignored, and these children not being prioritised appropriately. And they, no doubt, finding other ENT surgeons, but they're certainly finding me, where the parents are just absolutely desperate for help, and they end up just finding the ways and means to get their child sorted. And once it's done, the enormous differences that are made make it so worthwhile. So that's kind of what I thought I'd just reflect on, just in terms of the hodgepodge of ENT that I see. I hope that's kind of helpful, and that those that tune into these things will take a moment to also then share them. There's got to be something that I've said somewhere for a lot of people, and it'd be lovely for them to hear it. Cheers.